Hi everyone, how are you? It is Dr. Emily, functional podiatrist and human movement specialist, here to speak to you about neuromas, specifically a Morton's neuroma. Now that Morton's neuroma classically lies in between toes 3 and 4, and that pain usually presents way at the end of the foot in between metatarsal heads 3 and 4. So typically the patient will say that they feel a sharp stabbing pain approximately where my hand is, right around here, and it'll be every time you roll through the foot, such as when you're taking a step, maybe if you're wearing heels, you're doing a lunge, you're doing push-ups, anything that is putting your foot into that position where you roll through and you start to get an irritation between those metatarsal heads. Classic Morton's neuroma. Now, common causes of Morton's neuroma is going to be delayed stabilization of the foot. Oftentimes what has to happen when we stabilize is you actually retract and you pull a lot of the connective tissue out of the way so that you don't roll and pinch any of it. Also, if you wear tight shoes, you can prevent the foot from spreading and splaying. So an important part of preventing neuroma formation in the first place, or irritation to neuromas, is allowing sufficient foot splay. So that is avoiding any shoes that are too narrow and prevent that foot from opening up. So I've got 4 recommendations for you on how you can start to do or to reduce your neuroma pain. First one is going to be our trusty old toe spacers. So you're going to use the toe spacers, and by putting these on your feet, you are supporting not only digit splay, but also starting to favor metatarsal splay. So we want to make sure that we're trying to open up all of that small tissue that lies at the front of the foot. Now, in addition to toe spacers, one of my favorite foot pads is the metatarsal pad. Now, if you're going to use a metatarsal pad, you want to make sure that you are using 1/4 inch thick felt. Literally go to Amazon and type in 1/4 inch felt metatarsal pad. If you use something that is thinner, such as 1/8, 1/16, oftentimes it doesn't give the results of what you're looking for. So you got to make sure that it is thick enough and it is the right material. Felt is non-compressible, where other materials such as silicone and foam are going to be compressible. Now, when you put it on your foot, you want to make sure that it is far enough forward. So do you see that it's kind of towards this distal or towards the tips of my toes? So I'm going to find the ball of my foot and I'm going to place the metatarsal pad right at that area. If I go all the way onto my metatarsal pads, that's actually going to cause more irritation. So you want to find the ball of the foot, and then we're going to go just short of that. And that's where you want to place that metatarsal pad. Now, the purpose of the metatarsal pad is as you walk, you're going to push the pad and you're going to open up all of the metatarsal heads. So they're going to pop out, open, and splay. Remember, one of the biggest contributors to neuroma pain is compressing the forefoot. We need it to open up. So that's going to be the combination of the toe spacers with that 1/4 inch thick metatarsal pad. Now, what I recommend to patients is every day you want to make sure you are doing a release. So this is a small ball that you can find inside the Neuro Ball by Naboso. And it is something that's going to allow you to get in between these long bones in the foot to really get that connective tissue, bring hydration, and create good circulation through that small tissue. So this is an important part of it as well. And then finally, last if not least, if you do not respond to this recommendation and you're consistently doing it and you still have too much pain that is causing compensation or changing your activities and your quality of life, you may need to do an injection. The injections that I do for patients are either an initial steroid, don't get scared, an initial steroid injection to drop some of the peri-inflammation that sits around the neuroma, or I might do a series of alcohol injections. And the goal of the alcohol injection is to shrink or sclerose the neuroma. And then finally, what I do, especially for recurrent neuromas or what are referred to as stump neuromas, is I will do stem cell injections. So various different types of injections that you may want to consider. If you've done everything that I've recommended so far and have had no improvement, you might need to pull out those injections. Now, surgery is always the last resort. There's one more step in between here, which is called radiofrequency ablation. Might be something you want to explore as well. So in our summary, we've got our Morton's neuroma, which is happening between the 3rd and 4th digit. It is typically presenting as you roll through the foot because you are pinching and irritating. Tight shoes, restriction of foot splay, toe splay, opening up and spreading is one of the most common causes. Delayed foot stabilization is a common cause. And of course, footwear and holding your foot in that position, maybe for work, exercise, things like that, can also irritate it. 4 things you want to think about is toe spacers. We got our Nervoso Splay on. We got a metatarsal pad. Make sure it's a 1/4 inch thick felt metatarsal pad. Make sure you put it in the right place. Very important. 3rd, you got that daily release with that small ball. Remember the small one that comes with the Neuro Ball. And then 4th, if you're not getting any results, do consider the role of injections in helping to reduce that pain. To learn more about how I treat patients and functional foot care, please visit dremilysplickle.com. Thank you all so much.